Hey everybody. So one of the really important things that is extremely crucial to be thinking about when you're going through your pain healing journey, or when you're exploring different options for trying to figure out why you're in pain, and what you can do about that pain, is trying to figure out what the root cause of your pain is, the root cause of the condition that is causing you pain, because it's so crucial and important to actually address that root cause in order to try and have the most impact on your pain, on your healing, and all that kind of stuff. Now, I know I talk a lot about finding your pain generator and how that's not found through imaging. It's found through a good physical exam and things like that. But the other layer to all of this is taking that step back to ask, why is this pain here? How did it get here? And can we address that initial aspect to get the patient out of pain? Now, I'm going to talk to you about two examples that might help you to understand kind of where I'm coming from with this. The first is we have an overuse injury of the supraspinatus tendon. Generally, that's going to be called, tendinosis, or it's incorrectly called tendinitis, but it's a degenerative condition of the supraspinatus tendon that can cause pain with different overhead pressing movements and lifting the arm up to the side and things like that. Now, when a patient comes to me and their tendinosis is due to overuse in the gym, for example, obviously it's in part of my creating a program/framework for them to get out of pain, but also to prevent this from happening in the future, involves some form of neuromuscular rehabilitation, which is generally going to be done with a physical therapist, right? We want to ingrain the movement patterns that are going to have less stress on that supraspinatus tendon, so that way they don't get into a situation in the future with another overuse injury. However, just doing that generally isn't enough to resolve the tendinosis that's there that is contributing to their pain. And so that's where, when I'm using what I specialize in, which is the regenerative injections, prolotherapy, PRP, stem cell therapy, I'm still going to go in and address the root cause of the pain, which is the tendinosis and degeneration. And I'm going to address it with the things that I know how to do best, which is the injections. But on the preventative side, it's really important to then look at that deeper mechanistic layer, which is the movement patterns. So that's one example. On the flip side, if we have a patient who has peripheral neuropathy in their feet, for example, and that peripheral neuropathy is due to their diabetes, well, yes, there are regenerative injections that I can do, whether that's with PRP or perineural injection therapy or even exosome nerve hydrodissections. While those can be beneficial for temporarily helping patients with diabetic peripheral neuropathy, at the end of the day, we have to address the diabetes if we really want to see any long-term major changes in the peripheral neuropathy. And so in some situations, we address the diabetes and the peripheral neuropathy goes away or dramatically improves. In other situations, we address the diabetes, we get that more under control, insulin levels come down, A1C levels come down, patients get off medications, but the peripheral neuropathy doesn't change. That would be a great time to then intervene with a regenerative injection that's going to be more beneficial for the nerves, such as the nerve hydrodissection, but we don't want to be doing that at the expense of addressing the diabetes, because the root cause is the increased blood sugar levels, which is causing the microvascular changes, which is then causing the restriction in blood flow to the nerves, which is then causing the actual peripheral neuropathy. So please remember that while it's really important to find your pain generator in working with a provider who's going to help you to get through your pain, but it's also really important to make sure that you are addressing the fundamental root causes of your pain, so that way you can get rid of it more efficiently, but also prevent it from coming back in the future. All right, see you later, everyone.